Hello everyone. My DNP project is titled Implementing Opioid Use Disorder Screening, Medication-Assisted Treatment, and Referral in the Emergency Department. This is an evidence-based quality improvement initiative. To provide brief background of this project, as we all know, U.S. opioid problem has become a nationwide epidemic. More than 2.4 million people suffer from opioid use disorder. These opioid disorders strongly impacts all emergency departments nationwide. Research evidence indicates that ED is an opportunity to save lives, as ED is initial healthcare access for many patients, especially for opioid use disorder patients. Therefore, consistent screening is necessary to identify, recognize, and care for opioid use disorder patients in the ED. Research also indicates that early MAT initiation and prompt referrals to MAT clinic in the ED improve patient outcome for these opioid disorder patients, and they also increase patient survival rates. However, many EDs currently are not playing their part despite strong evidence out there indicating the need for ED involvement within opioid epidemic. The purpose of this project is to improve patient quality by developing, implementing, evaluating MAT educational program, early initiation, and implementation of MAT protocol within ED. High-quality researchers are out there indicating the urgent need for MAT protocol within the ED. Medication utilized for MAT protocol is buprenorphine, which is evidence to decrease cravings, reduce withdrawal symptoms, increase chances of retention in treatment, and decreases future repeated fatal use for high-risk patients. This project will be implemented in Mount Sinai Emergency Department, where there is no existing opioid use screening or protocol available at this time. This project is IRB exempted by Mount Sinai and Loyola University. Mount Sinai is located in southwest of Chicago, treating a high number of opioid, heroin abuse, overdose patients on a daily basis. In Mount Sinai, there is a huge need for standardized OUD MAT protocol and quality improvement plan for our patients. This project is divided into two parts. One is to educate staff about universal screening of all ED patients in triage and utilization of Cal scale to assess withdrawal severity. Staff will be educated about MAT initiation and referral to MAT clinic, a crucial part of the protocol. The second part will involve the actual implementation of the MAT protocol, where according to Cal scale, if clinically indicated, patients will have early initiation of buprenorphine to decrease withdrawal and decrease cravings. These patients will also be referred to MAT clinic from ED. Patients are discharged with naloxone kit and instruction of how to administer the medication outside of the hospital. Education will be provided by nurses. Project implementation and data collection is still in progress, and therefore results are still pending at this time. Through this project, electronic health record will be revised to include universal screening of opioid use disorder patients. Buprenorphine will be initiated early during ED stay once clinically indicated with high score on withdrawal scale. All of these patients will be referred to newly developed MAT clinic team. Upon discharge, patients are supplied with free life-saving naloxone kits with education on how and when to use naloxone. Education will be provided by the nurses. As EDs continue to serve as frontline access for opioid use disorder patients, early recognition and initiation of buprenorphine and appropriate linkage to MAT clinic is absolutely crucial. Sinai ED will also attempt to decrease fatal overdoses by distributing life-saving naloxone kits to patients to provide life-saving education, much supported by research evidences to be beneficial for patient outcome. This project will enable ED providers and nurses to manage opioid use disorder patients with evidence-based approach to provide consistent, high-quality care in order to improve patient outcome and increase chances of patient survival and ultimate recovery.